Hey, ladies and gentlemen, welcome to the new series of Let's Talk podcast with Abhash. If you are new to the podcast, I would suggest you to please subscribe to my channel in YouTube and also follow us on Facebook and Instagram. The informations are on the description below. And for today's podcast, we have a special guest. She is a registered nurse in Minnesota, and her name is Amreeta Timalsina. Hi, Amrita.
Hi, Abbas.
Oh, welcome to my podcast.
Thank you. Thank you for having me.
Oh, thank you so much for appearing for me. You are a nurse in Minnesota right now. Can you just describe me like what is happening over there, like with all the craziness of like coronavirus happen, like a situation there?
Yeah. So, first of all, I would like to tell I'm a very brand new nurse. I just started working from February, so the whole nursing world is new for me. But what I can say from my perspective is with the corona pandemic, it has brought a lot of fear among the general public. But the fear also there's a lot of fear among healthcare workers, including doctors and nurses, because after all, we also have our family, and then we also have a vulnerable people that we need to protect. So, with being said that, it has nurses and doctors are way more careful now with
Mhm.
infection prevention, cross contamination. It has already brought, like, we use mask and face shield during our whole shift. Hand hygiene has gotten so much better. And on top of that, I think there's a newfound appreciation in healthcare workers as well from the public.
Okay. We have a little lag, but the audio seems pretty good. So, as you said, you just started in February. This is like you started in the peak time of coronavirus situation there. So, was it like something you uh, like when you got admitted to the new job, did they like start you with like preparing for you? Okay, we're going to be prepared for coronavirus. You are in the right time, or was it like more of a normal way of transitioning to get to a new job?
So when I first started working as a nurse, or when I started my training, the hype of coronavirus has wasn't as much, obviously because the U.S. wasn't hit so hard by at that time.
Mm.
So I was obviously not prepared. But as I moved into our training, which is usually about a month-long training to be a nurse, we started wearing masks and talking more about how it can prevent, how it can affect the hospital system. By March or April, we started using a face mask, which is a regular surgical mask, not super protective or anything like that, on a regular floor like mine.
Mm.
We also used face shield from April or middle of the April, when some of our employee got accidentally exposed to COVID patients without using proper PPE.
Okay.
But on beside using PPE, the hospital also started creating a labor pool, which is not just unique to Alina. It is very common for other hospitals to create a labor pool to prepare for the surge of COVID pandemic.
So,
So, in order to, sorry, go ahead.
okay. So, like all of those PP, as you said, the nurses were not, they had not, well, it was everybody was learning and trying to do their best. So, was the gears different? Like, what kind of gears did they like prep you guys for? Like, for the extent of how the communicable this disease was it like some kind of special PP, or is it the same thing that we see around, like a lot of people prepping outside?
So what CDC says the coronavirus is transmitted to droplet precaution. So what droplet is, like if you sneeze or if you cough or whatever, it can be transmitted within 6 feet distance. So PPE is not an sorry, coronavirus is not an airborne precaution, is what CDC has been recommending or saying. So with that, we've been using enhanced droplet precaution. So what enhanced droplet precaution is, you will have a surgical mask, which is a regular cotton mask. And on top of that, we also use a face shield or the eye shield, so which is just like a standard visors to protect your eyes. What it does is like it prevents you from getting all the droplets when patient cough and sneeze. And I am sure that that has been a learning process, because when we first started getting corona patient in our hospital, not in my unit, we just used to wear masks. But after repeated exposure of corona patients without using proper PPE, the hospital recommended using the face shield. And I can certainly provide you with pictures of
So those are
what.
those face shields are the N95 masks? Or
No,
no.
the facial, I don't have it right now because I have it in the hospital, but those are like a plastic coverings that goes on top of the
Oh, okay.
mask. So like they have a band around, and then it's kind of like a glasses, but it goes up to like your mouth, I
Yeah.
guess, like up to your chin.
And like, does the nurses have not been wearing PP like N95 ones? Those are the one that are like really sealed to your mouth, right?
Right. So N95, it has been really controversial. I think I don't know if I think it's had been controversial around US if the nurses who are not directly caring for corona patient, should they use N95s or not? Because N95s are limited in supply,
Mhm.
at least when it was back in April and May. So we just use a surgical mask. We don't use N95 unless it's a airborne precaution, which coronavirus is not deemed as an airborne precaution.
Yeah, like I remember when all of these news was spreading out, like the people from China's, like when they started quarantining the entire province in China, and like I was like getting prepared myself, so I kind of purchased it. And 95, I did not know those were like they hiked the price up really much, and I thought those were like, oh, that's pretty expensive mask. I don't know how people are going to afford that. But then I found out those were like not there were not good supply for the hospitals, and I was in a conundrum. It's like, should I keep it myself or should I give it to the hospital? And then I heard news like the hospitals don't take the opened up masks or the
Right.
package that has been opened up. So I already had it opened. So I'm like, yeah, I guess I have to use it.
Right.
So I just had distributed it among my friends. So one thing I would say about that PPE, that N95 mask is it's extremely hard to wear for like, of course, as a nurse, you guys have to uh, put it on your face for like 12-hour shift. For us
Right.
to wear it just for half an hour, it was extremely difficult.
Exactly. And for us, like I work in a med surg floor or progressive floor, so which we don't get corona patient, at least for now.
Mhm.
We have a designated floor to take care of corona patient. So on those floor where the nurses and the other like nursing assistants and doctors who take care of the corona patient, those floor they use N95 mask, but for us we use a regular surgical mask. And even I agree with you, like even wearing a surgical mask for 12 hours is no joke. Like it's really hard.
And that's one thing about being a nurse is your shifts are mostly 12-hour shifts. That's
Right,
insane.
for the most part.
That's just shows you the difficulty of being a nurse.
Right. Yeah.
And like for those people, like what is the condition you're in Minnesota right now? What is the condition of number of patients who are coming in as a coronavirus, like infected with coronavirus?
So I definitely say it has been as if talking from the end of March situation, it was creeping up the number. Even the hospital I work for, we had a lot of corona patients coming up, and at one point, the hospital planned to open the unit that I was working
Uh-huh.
for a corona patient if the surge happened. But as of right now, the hospital patient who are staying in the hospital and who are admitted for corona is much more less than what it used to be in May,
And
for
like
sure.
because it's everybody's prepping for coronavirus and all the wards have been isolated and barred off. What about the regular patients who has like who come there for regular stuff, regular as sense like other beside coronavirus? Has it been any effect on those numbers?
Oh yeah, definitely. So with I guess I cannot say it as of right now today's situation, but when there was a peak of corona and when the Minnesota and including other states were in the states of stay at home order, there were our unit, which is a neuro unit, which people come for stroke and brain injuries and things like that. We actually had to close our two station, which means our patient number of patients coming to us were less than 50% of the regular volume.
So that's a lot
And
of less people come in because of
right,
were
and
they like mhm. Were they
that has to
fearful of it?
Yep, right, exactly. So with the fear of coronavirus and not like just being uncertain, people were not coming in, and that was not just in my floor; it was actually in hospital wide. We had a low census.
Okay, so the patients were more afraid that they might be contaminated at the hospital. So a lot of the people
Right,
were like afraid to just come to the hospital.
right. That was the
So
situation. Yes,
that kind of gives you the scenario that how scary the hospital has become because of the pandemic. And
exactly.
do you feel like you're personally is your safety good enough?
Uh, I would not say it's good enough. Um, and I'm tying back to the incident where I was exposed to coronavirus patient. I cannot give you a lot of details because of the HIPAA, but
Mhm.
what I can say is me, including a lot of my nurses' friends and my coworkers, were accidentally exposed to a patient who had a coronavirus without proper PPE. Means we didn't have a face protection, we didn't had a gown to cover our body, and we were exposed for more than three days. And at that point, I just felt like we're very vulnerable because that was not just an isolated incident. There were multiple incidents where the nurses were exposed.
And
So
did,
obviously, I don't feel like I'm safe enough.
yeah, did you like have testing done?
No, absolutely not, because that was back in April, and we have a nurses union, and I'm not very involved in nurses union just because I'm very brand new. I'm still trying to learn, but I know our nurses union was trying to fight for us nurse getting tested for the at least the one who are exposed without proper PPE. But because the nurses, including myself, we didn't have a symptoms of like fever, chest pain, and things like that, we didn't get tested, which I thought was very unfair.
It does seem unfair. It's especially like if you guys like people who works in the hospital get infected, that means the patients get less treatment. Any patient that
Right.
compounds that compounds the problem. And I know, like, with the case of COVID, from what it is now, we don't know who actually have it. I might have had it. I don't know. Like, it's the asymptomatic number of people who have this virus are so large in number. That's what's being
Exactly.
discovered, and maybe that's a good thing that it's not affecting everybody in a bad way. Maybe we already
Right.
have immunity, not immunity, but already have antibodies for it. So,
Sure.
in that sense, it's a good thing. But for you who just started working in a hospital and being in the just starting in the start of the pandemic and not being able to have all of those proper gear, kind of feels definitely extremely unfair. But for people who starts to come in as a nurse, like it kind of gives them insecurity to begin
Exactly.
working as a nurse. Like, how has your
Right.
others, like other nurses, other friends, been corresponding regarding this, like whatever happening there?
So I think you have to be a biggest advocate for yourself. So a lot of nurses, including myself, we obviously follow the chain of command, and we talked about how we're exposed, and our managers are very receptive of it. It just I guess the fault is not just the fault of the management system. It's just the whole statewide. They don't have a lot of testing kit, at least at that time.
Mm.
So we were told to monitor our symptoms and report to our occupational employee health if there is any symptoms, and then follow the precaution. And that was the option. Obviously, this that option wasn't good enough for us. But after that, our hospital provided us with a face shield, which are very bothersome to wear, but I think they protect you at least from a lot of droplet infections.
Okay, I mean that's something that should have already been implemented. Even
Exactly.
the grocery stores around here have that. I mean, I don't know
Exactly.
how good of it is, but that should have already been provided. And like before, like February, like before you started as a nurse and started doing your regular job, like were you an intern there, or how did you get started on the hospital?
I was I moved from St. Cloud, so I was not an intern. I did a internship experience in St. Cloud Hospital in their intensive care unit. I also did my capstone senior project in the hospital in St. Cloud. Um, but I moved down in the cities, and that's how I started working as a nurse.
So before you started in a hospital, you have to go through a lot of training and a little bit of internship kind of thing within the smaller, like city hospital, St. Cloud State Hospital, which are the
Right.
smaller hospitals. Is it smaller hospital or is it more like a clinic?
No, Central Hospital is not a small hospital. It kind of is a regional, actually. It has equally the same number of resources as the hospital that I work in.
Okay.
It is in a different location than the hospital I work right now, but the treatment the Central Hospital can provide can be provided at any hospital in Minnesota. And some clinic like Mayo Clinic and University of Minnesota are the level 1 trauma center. They have more resources and more research. But Central Hospital in itself is a pretty good hospital in terms of resources and
Yeah, first,
equipment.
those students who are about to graduate their nursing. So I kind of it gives information that while training, they actually train you in a proper hospital, not just in a smaller hospital, but actual hospital, and go through the entire process before you are hired as a nurse. So, like, how was your internship like experience there?
So internship, I really loved my internship experience. So what with nursing, I just wanted to clarify is you can get hired as a nurse even without having an internship or a training or a capstone. There are various routes in order to get a job in nursing field.
Mm.
But for you to get the desired job with the desired hours, which is very important for nursing, you have to have a different set of qualifications. So with that being said, having an internship is a very really big factor, and working as an intern in Santa Clara Hospital provided me with like a different view of what I wanted to do as a nursing in the long term. It also prepared me to actually talk to my patient as an like individual self instead of like hiding behind your preceptor. So it definitely provided me with a lot of confidence as well.
Yeah, like I've been talking with my recent guest was Rasmi Gahal, and she was just giving the explanation of why the internships are really important in providing yourself an opportunity to know the business and like going inside and getting the connection to so that you can get hired. But I was just curious about, is that the same in the nursing area field as well? Because a lot of people who I know there are community colleges that provides like 2 years of a nursing
Right.
program, and you started in the university 4-year bachelorate degree. So is
Right.
there a difference between 2 years and bachelor's degree?
So in terms of the licensing, like a registered nurse, that's what I'm doing right now. It's the same. The nurse who goes to community college, which is a 2-year program, versus the nurse who goes to a 4-year program, they take the same NCLEX, which is a national testing, and then they get the same licensing. But in terms of 4 years versus 2 years nursing, 4 years is required by a lot of hospital right now because 4 years focused on more holistic approach, and with 4 years, you do a lot of training. You have a lot of clinical hours, which a lot of hospitals prefer right now. With 2 years, also, you certainly can get a job. You can certainly get a job in hospital as well as in a nursing home. But right now, most of the hospitals are requiring you to join back to bachelor program eventually. So,
Okay, so bachelorette has its own importance, and
right.
like the nursing program itself feels like really difficult, like compared to 2 years, and since they are focusing more on the 4 years one, like whenever I see, I have few friends, including you and other friends, whenever I see you all, you say you're a nurse, I see like you always studying compared to others, other degree program students. Whenever I see a nurse, they're always studying, always in there with their books, with big thick books, like 5 different expensive books as every semester,
Right.
new ones. Like, why is nursing such a difficult program? Like, is nursing a really difficult program?
I think it's borderline. I when I went to nursing school, that was like 6 months ago. I finished it. I what I felt like was it not necessarily very difficult, but very content heavy. So there's like a one semester, and then you have to finish a pediatric and the maternal parts, and then there's also research for nursing. There's also cultural classes for nursing. And then those classes also come up with their own clinicals, which means you actually go in the hospital, clinic, nursing home settings, and then with that comes a lot of papers. And then I think that's what makes a nursing student very busy. Obviously, it's not an easy measure. It's like the nursing student have to put a lot of hard work and effort. But what I think is the coursework itself is not very difficult. It's very content heavy.
Okay, content heavy, as there's a lot of things to be studied. And
Right.
in the nursing system of United States, do you feel like it's like compared to people who go for a doctorate degree? I've not met any doctors here, but doctors in medical science. Uh, is the nursing, because I think because of the content heaviness of the program itself, how close are you with being an actual doctor on the level of education that you receive?
Not close at all.
Okay,
I
doctors even work really
no,
hard then.
no, like if I am talking about I really love my profession. I have nothing to do against doctor or being a nurse,
Mhm.
but I've been doing my own research on going on to further education, and there are a lot of options that nurses can go to, and like being a doctor is not sorry, being a nurse is nowhere closer to becoming a doctor academically. Yes, you do a lot of hard work. You basically have a same goal,
Mhm.
the patient health of a patient.
Definitely.
But the doctor, in order to be a doctor, which is an MD program or a DO program in America, you have to finish a 4 years of bachelor program. So it can be any health related, non-science or science or whatever
Mhm.
related programs. On top of that, you have to go for 4 years of medical school.
So that's
And
on
that,
top of it.
right, 4 years. So that's 8 years already.
Mhm.
And that doesn't make you a doctor. You're not even close. And you have to do a 3 year more of residency, which is you work in a hospital as an intern. So
Okay.
that's like 8, 11 years already. And that sometimes, even if for you to be a surgeon, that's even 3 more years. So it can for very well take 15 years to become a surgeon in America.
Is that only in the United States, or is it the same in other countries as well?
I'm not entirely sure. For sure, in Nepal, you don't have to spend 15 years because our residency program and our MBBS program, you can enter directly from your plus two or high school.
Mhm.
So I cannot speak for other countries, but academically, for sure, doctor focuses on they focus on the medical aspect of anatomy, physiology, how to cure kind of thing. And for nursing, yes, we study a lot of books, but our care is focused on the nursing based care. It's a different foundation.
Okay. Yeah, I'm just curious. Like, I just feel sad now for the doctors. It's like you have to study for 4 years undergrad and 4 years of another medical courses, and then go to
Right,
residency, and then you have to study extra for specialization. That's just like study,
right,
study, study. And then once you're a doctor, you never stop studying because there's always new things coming up, and you're always constantly updating yourself.
exactly.
That's like,
It's like a commitment to lifelong learning. And I really respect the doctors because they put a lot of hard work, a lot of student debts for sure, and a lot of studying into becoming a doctor. And that's nowhere near to becoming a nurse, but our foundation is different. Nursing foundation is based on providing a holistic nursing care,
mm.
and medical foundation is more of like treating, caring for illness.
And do you like,
But those,
uh so like your foundation is basically caring for patients so that the doctors, whatever they prescribe, can get everything is run over by the patients, and everything is taken care of. How much of the training do they do for you to handle a stress kind of situation? Like, have you yourself like faced any kind of situation where you are like, I don't feel prepared to be a nurse?
that's every day. And I've worked with a nurse who were a nurse even before I was born. I work with them every day, and that's them. Like they don't feel prepared, and it's a reality of a nursing job, and I think it's a reality of every healthcare related job. Even the doctors who are working for years, I don't think they feel prepared, because each patient comes with a different story, and each human being is a different person, so you cannot really apply A to B to C. So it's a different person. And being a new nurse even adds more stress because you're not just caring for the patient. Like there's so many aspects that has to line up. You have to work with a multidisciplinary team, which includes doctors, physical therapists, speech therapists,
Mhm.
all kinds of therapists, social work, community workers, and uh, the list goes on and on. So obviously, the stress is very high with working as a nurse, but I think it's very prevalent over in healthcare.
Yeah, and that's what makes it the job itself super honorable. Like I respect that job so much because especially like with you as a friend, I have my sisters and others, my family members who are in different lines of nursing and healthcare
Right.
providing. Those have a so during this pandemic that gives a sense of how much stress level they are in, how much risks they are taking, and how much they are putting their own life in the line. That's a completely different sense of what people think as a nurse, especially is for a lot of people they have had some kind of experience going in hospital, but they have never been in that situation where like your life is extremely, you might face up somebody who is dying, somebody who might have
Exactly.
been shot. Like have you ever had those kind of like really like insane moment like till the moment you have worked there?
Um, I think it's just very unpredictable world with being a nurse, and a lot of people don't understand, including a very close friend of our mine, and like most of people think, oh, you must follow your doctor's order all day. In reality, it's just you don't have to do that. You just work in a team, and the doctor is there to facilitate the caring program. But in the day-to-day life, I see a lot of people whom we transition to comfort care, which means the end of life care.
Okay.
There are a lot of, I cannot say how many, but I have a handful of patients who died on my shift, and it's very challenging to transition from taking care of a patient who is dying to coming home and not think about it. It's very hard emotionally.
Yeah, it's
um,
I don't know how you would take that. Like I've never well, I have had many deaths in my family too, but I've never seen somebody die or pass on to another state of life. But that's something you have to forget, come home, eat your dinner,
right.
forget about it, watch TV, and go back again to the wardrobe.
Right. And it's certainly like when I did my internship in the ICU, I saw a lot of death because it's that the floor is like take care of a lot of critical care patients. And with that, I saw a lot of young people die from traumatic brain injuries, a lot of brain deaths. And that was really hard because they were breathing on a machine and they have a family on their side. And then you telling them that
So
they're not
you
going to
have to
be.
tell the like the family that their son or daughter would not be living.
That's going to be the doctor who has to break the bad news. But
Oh my god.
with the doctor are only available for so many minutes of the day. So it's going to be the nursing who has to do education on, okay, this is what happens and this is what the plan is. This is how we are going to coordinate. And we are going to make sure your loved one is comfortable at the end of life. And it's a very hard conversation. And just recently, I had to talk with a family member who were very confused about their loved ones to go on the very aggressive treatment route or comfort route where the pain is managed and then they're let to die peacefully. And those are very hard conversation. Like how can you tell their son or their daughter, hey, your mom is dying, we have to figure out what kind of treatment plan you want. And
That
that's that is very like heartbreaking situation, but you have to do it professionally.
do they teach you like do they ever consult you as a in your programs like there are going to be time when you have to say somebody is dying and you have to brace yourself to say those words?
I mean, not exact same words, but we do a lot of, at least in my program in St. Cloud State, we have a course designated for older adult, which is where we do a simulation of death and dying of Native Americans, death and dying of Asian, and things like that. But that's nowhere near to an actual patient interaction and actually dying. And it's gonna be a lie if I say, oh, I don't feel emotion. Obviously, I feel emotion, and there are many times I've hugged family members, their daughters and sons, and told them, it's going to be okay. You just have to fight through it during the hard time when the patient wasn't pulling through it. And there were many times we have provided with like a comfort words to a patient's family when they're dying, including a patient's self. I think those are the skills. You're always going to be uncomfortable no matter how long you work, but you just have to work on it and be comfortable with what you're uncomfortable with.
Yeah, it just gives me like super, it gives raises my hair, saying like you see somebody like pass on their life, and then
Mm-hmm.
you'll be just like, oh, I have to tell your family that you haven't survived, or just seeing by their side, and you as a nurse cannot do anything because sometimes the doctors and nurse are just, you are not
Right.
like, you don't have the power to like
Save lives.
save lives. It's just you have a power to try to save lives as much as possible. And like for the first time, like how did that impact you the first time you saw somebody die?
So for the first time, it was a very complicated case. I remember the patient I had was a brain dead, that was kept alive on a ventilator. So the patient had a full blown pupil, which is not normal. No gag reflex. So that's a lot of signs of brain death.
Okay.
But the family was very adamant to keep the patient alive on the ventilator,
Mm.
which is it's a story of every intensive care unit.
Everybody wants their family member to
Right,
not die, right?
right. So, and the next day I worked, we pulled the plug. The doctor talked with the family, and then the family talked with the nurses. And then we decided to take the ventilator off and let them breathe on their own. And within hours, the patient ended up dying, which was an expected result. But the just the sheer amount of emotion that was in the room, including the nurses and other caregivers, was very intense. And I remember like being full of tears and giving morphine to that patient and just thinking, oh my God, I'm so lucky not to be on that side of the room. And I think that just made us appreciate my life more.
And that's one of the thing is nobody is invincible, and we're all going to pass away. And it's just being able to try to help out whoever is in that condition, trying to help out as a nurse for you to treat the people. That's like a godly work. And those are really interesting things. I'm just like, I am one of those people who is like, I cannot see like somebody be in absolute pain, and I have to keep myself in distance because I start to feel like really I'll be panicking. I'm like I'm not good with blood, or I'm not good with intense situation.
Right,
Luckily, I have not had faced it in my eyes like that much of it. Of course, everybody has faced some part of it, but seeing the
right,
doctors and nurse go through it, and then when you become, eventually I think everybody becomes so used to it that you start to become a little tougher, and you start to
mhm,
become a little bit rigid on those scenarios. And you have like seen 10 people die, you've seen 100 people die, you've seen 1,000 people die when they get old in the nursing hospitals. And then you get those start to become a little bit stonish. But there's always that part of the humanity. It's just like no matter how much of a nurse you are, no matter how many deaths you have, you just have to keep on going. One death is not
right.
gonna put you down to support the next person that needs help.
Exactly. And I think it's a regular, normal human response to any death or dying. And how I think most of the healthcare workers cope is by sharing how they felt about the patient. And a lot of hospitals now have programs like air care, which is online care where you can discuss with the therapist about how you feel about the dying of a patient and how it affected you emotionally. And I think with those discussions, it just makes it a little bit easier to face another assignments. No two deaths are alike, so you're never prepared enough.
Mm.
But like you said, the time just makes it a little bit better with healing and dealing with emotions.
Yeah, it's time is certainly a factor when which heals, and which like more the time goes away, everybody starts to accept it, and that's what our life is about. And like we talked a lot about bad, like not bad thing, but more sad things. But like, what is the happiest thing that you did, like that you have faced while working as a nurse there?
Um, I think I can only think of one situation, but I recently I had a patient who was in hospital for longer than 10 days who was suspected to have a COVID, but he or she didn't had a COVID result, so it was negative. So my patient ended up going home. Obviously decided not to take a treatment anymore and go to home and die peacefully. And the day I discharged my patient, she was in full of tears and she gave me a biggest hug and
Oh,
told me that I made her feel comfortable. I made her feel like she is valued. And those kind of days, obviously, right, those kind of days, like you don't see a lot of days because most of the time you deal with pain and patient's comfort and things like that. So that made me feel really special. And I think there are more than one situation every day where you feel like the job I'm doing is very worth it.
so is it more happy situation or more sad situation in your like from your comprehension, like just average it out? Are there more good situation in hospital or more sad situation?
I think it depends on whom you ask. For me, it's more like a 50-50. It's more stressful because it's not sad, but it's just more stressful because you are juggling so many things at a time. But I say the comfort you get from making difference in somebody's life, the happiness outweigh the sadness part.
Yeah.
It's not every day you see death, or it's not every day you see pain. Most of the time you're able to do one thing or the other to make them feel better.
Okay. And like this is comes down to like what you expect as being a nurse. Who would you say should not be a nurse? Like for the people who wants to, like for our audience who wants to go into a nursing program and try to see, is it for me? Like that question for every major, there's always that question. But nursing and the healthcare sector itself is a different kind of beast of what you need to progress in your life. Who would you say should not be a nurse?
um I think if you're not a people's person, if you don't like talking, you definitely should not be a nurse because more time than not, you're actually talking to someone, either it to be over phone or face to face. And other thing is like if you only think like making money is your motive, then nursing doesn't really pay as well enough. You do a lot of hard work and a lot of running around, a lot of walking, a lot of doing this and that. That's not actually within the scope of your practice to make somebody feel better. So if the making money motives and not really a public person, then it's not a good profession for you. And I think it goes for a lot of other profession because if you are there just to make money, you feel burnt out really fast. And there are a lot of profession you can make money
Yeah.
without actually working so hard. So
Yeah, like you don't want to meet a nurse in the hospital who is there like, oh, I'm just here to make money, and
right,
give you take care of all her responsibility and get out of there and go to home. You want somebody who takes care of people a lot. And like one thing about like being a nurse in the United States is at least the people, the community and everybody respects the nurse as much as we
right.
do. Like I don't know how much experience you have with getting information about nurses in Nepal, but I almost feel like they don't get appreciated as well as the nurses up in the United States.
I totally agree with you. I don't have a lot of information, but what I can tell from my own experience being in the hospital and being with my parents when I was in the hospital is in Nepal is nursing is not regarded as a good profession at all.
Mm.
There's a lot of saying that, oh, like if somebody's daughter is a nurse, she must be very outgoing, she must be very bold and things like that, which is not considered good in our society. It is also considered a job of cleaning, like cleaning the mess, cleaning bathrooms or whatever in Nepal. What I think is getting better, it's a certainly in getting a good prospects with educations and with people going from different countries and advancing the education. But I feel like there's a lot of ground level work that needs to be done in Nepal
Yeah. Like
to
I
make
had
the
had
nurse.
a friend like who was in a nurse in Nepal, and they say it's like, is nursing good? And they always have that like, it's okay. It's almost like they don't feel as appreciated for what of the risk they take. What of, like, as we say, like there's number of corona cases rising in Nepal as well, and how much different type of risks they are involved in directly, because whenever the patient comes, they don't have proper PPE, or uh, they just get they just feel like the frontline workers who are minimally appreciated. They just clean up, as you said, the clean up and take care of the patient, and they give them medicine and the scream at the patient. That's what we have. We have how do you say, a stereotype of nurses is like they are really mean, and
Right.
they always scream and gives you injections. So there's that. But like, it's not the people have don't feel like the realization of what the value actually is compared to the doctors, who are highly regarded and highly appreciated. Nurses come pretty close to what the job description is, to save the people and make sure the hygiene is properly cleaned, they don't get infected, and
Right.
everything is taken care of. The level does not seem the same.
Right. I agree with you. Like the nursing is here. Like if you say I'm a nurse outside and people are like, "Oh, you're a nurse. Wow." Like, there's a little great appreciation. In fact, the nursing in America is regarded as number one profession to be trusted.
Hmm.
I think last year alone, like over 90% people think the nurses are the most honest workers they have seen compared to all the job descriptions. And whereas if you go in Nepal, like a developing countries like Nepal, what even in the movies and even in real life, what you see nurses are yelling at patients, screaming at patients. But I think it has to do more with a systemically, not working more on the scope of practice of nursing. What nurses can do here in America, with the certification, with the additional training, with going to school for masters and higher level, the nurses back home cannot do those jobs. And there's simply not opportunities for them.
That
And there's not a uniformity, like in hospital in America, the scope of practice, which is what a nurse can and cannot do, is uniform. Whereas in Nepal, it depends on the hospital. Like some hospital, the nurses have like they can do this, and that. And in other hospital, they cannot do those things.
so they're
So
just
I
like,
think,
they're just like positions. They just hire you for like specific job things, and they just
right.
one job title. You say you're experienced in one of the hospital in Nepal, you might not be able to use those skills in the other one.
Right, right. Whereas here, it's the scope of practice is like, the nurses cannot diagnose a patient, but we follow the doctor's order. But nursing has our own diagnosis. So if a patient come with a heart failure, that's a medical diagnosis. The doctor used those diagnosis. But for nurses, it's fluid volume overload. That means the nursing have their own diagnosis too.
Mhm.
Like you don't have to do your intervention based on doctor's diagnosis. Whereas in Nepal, the concept of nursing scope, nursing foundation has yet to emerge and has yet to go uh, with the education and research, I think.
Yeah. So, like, I know you came from Nepal and you pursued your undergraduate degree in United States as a nurse. So, like, just basic question, like everybody want to ask you is like, what made you try to become a nurse?
Um, at first, I came with the same mentality as Nepal. Like, nursing is not that great profession in America, in Nepal. So I thought it might not be the same profession in America as well. But I had an opportunity to talk with a few Nepali students who were actually doing a nursing program, and they had nothing but to say highly of nursing. It's how great of a profession it is, and how hard it is to get in the program. So I went to a couple pre-nursing classes and hung out with more students.
Mhm.
I did my own research, and then I found out the nursing here has a lot more opportunities. You can spend your time behind computers,
Mhm.
making calls all day, or you can spend in the hospital, or you can work in a university, or you can work in a school. So there's a lot of areas that you can go, and you're not just stuck in one place. So I did my research, and I thought that this profession can really fulfill my passion towards working for healthcare. So,
That's a lot of. I guess you were like a lot of you had a lot of confusion beginning to get inside
right.
nursing. So if our audience, if anybody wants to get information about should I start with nursing, what can I expect as a new student, or international or national students in United States, like what advice would you give, saying like is this the right degree for you? What can you expect? What kind of classes and what kind of torment you are expected to get into this program?
For what I would like to say is, first talk to your advisor in the school. If you're studying as a freshman and you don't know what major you wanna enroll in, the first thing is you wanna talk to the advisor. And if you think like nursing or healthcare related job is something that's for you, what advice I would give is find a shadowing opportunity. So what shadowing is opportunity is so you follow a nurse or a doctor or a physical therapist or whatever you're interested in the hospital, and then you work with them for 2 3 days or more than that in some time. You don't get paid for doing that, but what you learn from that is that a really a good profession for me? Can I see myself running as a nurse or as a doctor or as a physical therapist when I graduate from school?
Mhm.
You want to ask yourself that question, and definitely finding friends whom you can share how the coursework may look like, and how you can work to be successful.
So like there's a lot of courses, and are the nursing program different according to different schools? From your knowledge, like is it similar most of the schools of what they actually?
Most of the yes, yeah, it's not a lot of difference. You no matter which school you go to, you have to do a clinical hours, which is the hour you'll spend in hospital doing an actual patient care. You might be following a nurse, or you might be following your clinical instructor, which is also a nurse. So you're basically doing this and like a part of job of what nurses does in a day, and that would provide you a bird's eye view of what nursing will look like.
And the cost around studying nursing is pretty similar to other programs as well, or is it different?
Is a little bit different. I think Suncoast State charges, I don't quote me on this, but I think it's a $50 extra or something for per credit.
Okay.
Um,
Those probably differ from school to school, but
right, right.
it's nothing of a
But
specialized. Say some no, like pilots or so on programs have completely
no,
different way of expenses.
no. I mean, it's a lot of getting up early at 5 a.m. in the morning. You're excited if your class is at 8 because you get to sleep in until 7 or whatever. Because like you're so used to getting at 5, going to clinicals 5:30 or 6. So
So how was this education? Like you had to get up. You had to get up at 8, but like your courses and all of your things goes all the way till the morning.
no, no. So what at least what I did when I was in school is you on Monday or Tuesday you have a class all day, so where you learn a theoretical aspect of nursing, of how to, for example, how to provide care for a patient who come with like a trauma.
Mhm.
And second day you go on the Tuesday, or the following day you have a clinical day which starts early in the morning at 5. So you have to make a care plan and with go to the hospital actually, and
That's a
that
lot of
usually is
commitment.
about 5 to
Yeah,
6.
that's
Yep,
not
it's a
like
lot of
I would not say it's like similar of education level to other programs, because we never woke up like 5 a.m. classes.
fun.
We probably had
Yes,
evening
and
classes.
that's different. Yes, and sometimes even our like when we have a weather cancellation because of a bad weather snowstorm, St. Cloud State used to make an announcement at 8 o'clock and 9 o'clock, and we would be at our facility at clinicals by then.
Okay.
So we had to wait from our own clinical instructor who is independent to make those decisions.
Mm.
So it's a lot of getting up early in the morning and staying late because you have to finish the care plan or the coursework.
Yeah. So
So
whoever is trying to become a nurse and is a little bit lazy, you might have to change the whole. You might have to change your life. This is going to be not an easy job, or not an easy course to
right,
go through. So
exactly.
lastly, I would want to ask is, after like studying for that much, like you have to the education itself is super intense. You have to study a lot and wake up early, go to job, and not always be happy. There's a lot of sad stories and a lot of good stories. Like, how do you feel? Like now you're a nurse. Like, how do you think you made a right choice? Or like, what makes you feel like, did you choose right being a nurse?
I am definitely very happy with my profession right now. I see myself being in a different position in coming years, in 2, 3 years, because I want to learn more. But I am very fortunate that I get to care for my patient for my living. I get to make differences in people's life, and obviously it's not same as you don't, as it's in the movies, like you don't make a dramatic changes in everybody's life.
Mhm.
But it might be as simple as giving somebody a pain medicine when they were in a lot of pain, or giving somebody just a warm blanket because you don't have any more pain meds to give them,
Mhm.
just making those small changes in somebody's life, or simply just advocating for your patient's health when they're not able to, which you might be doing every day. So those kind of differences you make in the life is very worth working as a nurse.
Okay, that's amazing for all the job you do, and for all the people, all the nurses. Thank you for your service, and that's that's one of the amazing thing about being a nurse or being into healthcare profession is like you directly impact your patients. You
Right.
directly say your customers. I would not say customers are you are your work is being directly visualized. Whatever you
Right.
do is being impacted directly to their lives, and that's one of the rare professions in healthcare and maybe others as well that is nowhere in comparison to other most professions, in the sense like, thank you so much. That's a lot of information and a lot of I'm really happy to I get to talk to you, because nursing
Yeah,
has
no problem. Thanks for inviting.
yeah, nursing has never been in my option of education, but I always knew, like, I appreciated it, and I never got into detail about talking of what goes into the daily life of nurses or doctors. So thank you for your time in explaining those little moments of good and bad things, and for maybe it might help our audience to get to see if they might be getting into nursing field.
Right. Yeah. Thank you so much for inviting me. I really enjoyed talking.
Oh, thank you so much, Amrita, and hope you do well and further education, and hope the coronavirus goes away so that everybody can take off their PPE and breathe normally.